So the lack of reliable data on metastatic patients is a travesty.
Hospitals are generally very good at recording a patient's primary cancer diagnosis, their first cancer diagnosis. But if a patient has a progression to metastatic disease, that isn't always recorded by the doctors and nurses, and it doesn't make its way into national data sets that we use to plan services.
This is a real weakness, and we need to do something about it.
One of the things that we want to do is an education piece with our staff to make sure that they really understand how to record metastatic patients within the data.
If we had the data, then hopefully that would encourage more researchers to actually start looking and treating and finding new trials and treatments for us.
The fact that there is no reliable data set which tells us how many patients are living with metastatic cancer makes us feel like our lives aren't worth counting, like they're not valuable.
My team is looking at closing that gap that we've got in the metastatic data, basically looking at all of the data sets that we've got access to. That could be A&E data, it could be prescriptions data, it could be mental health services data, and we're trying to look for evidence of metastatic disease within those data sets rather than just relying on the cancer data sets where we know that there is this little bit of a data gap. The work that we've done in testing an algorithm to identify breast metastatic patients is showing really good promise. And what we want to do in future is try and expand that to the other tumour types to provide an equitable service across all the tumour types in Greater Manchester.
Accurate data collection is the driving force behind any kind of progress, because if you don't know how many of us there are, how can you possibly plan for our care?